we've expanded the services here. We're trying to bring the best care that we possibly can to you, our customer. Next slide, please. All right, first things is, where are we located? Well, the University Health Center is located at Longwood Landings. We're not exactly on the campus. We're across Main Street, across from Domino's and Subway. We are open 8 a.m. to 5 p.m. Monday through Friday. We close from 12 to 1 for lunch. We are not open weekends or holidays. You see listed our numbers. Our fax number is important and our email is important. I'll get to that later. This is being recorded, so you will be able to find these later. It is also on our website. Next slide, please. Our staff, like I said, I am the director. We also have Dr. Robert Wade, board certified family practice physician, as our medical director. He's been in practicing for over 20 years. We have Harriet Vincent, nurse practitioner, Jean Strunk, our women's health nurse practitioner, and she is with us 3 days a week. And Dr. Marshall Wigfall, a psychiatric nurse practitioner for anyone who might need care requiring medications. Now, Dr. Wigfall does not do counseling therapy per se. We have a good relationship with the counseling and psychological services, CAPS, if you will. If you only need counseling and such, we will be referring you to them. Dr. Wigfall pretty much handles cases that need medication. Next slide. Okay, we are like any other family practice office. We offer a wide assortment of care and make every effort to provide all the care we can to keep our patients out of the emergency departments. Now, our psychiatric services, I just went over. Dr. Wigfall is here 1 day a week. And she is not here, though, when school is not in session. So she's not here during winter or the summer breaks. During that time, we would expect you to see your PCM or the therapist that you are seeing currently. Now, for ADD and ADHD evaluations and such, we can do those here. If you're currently being evaluated and followed by another practitioner, with telehealth and electronic prescribing becoming so prevalent, it's best that you continue with that provider so they can continue to manage your care and have the continuity of care that goes along with that. Next slide. We do offer immunizations here. Every fall, we do offer the influenza vaccine, and we will team with the Virginia Department of Health to come to the clinic and provide vaccines and boosters for people who are not in compliance. We also have a nurse advice line. Like I said, we are closed on weekends, we're closed on holidays, and we're only open 8 to 5. This nurse advice line is for that timeline. When we're closed, you can call them and they will give you advice and let you know what you need to do, if you need to go to an emergency room or urgent care facility, or what you can do to make yourself feel better till you can be seen the next day. What they cannot do is make an appointment for you or access your medical record, get lab results and things of that nature. Next slide. Okay, how to be seen. Currently, we are only seeing patients by appointments. This is due to COVID-19. I'm hoping that soon we will be able to open up to walk-ins again. But to make an appointment, you call our main number and you will be asked a series of questions. Based on the symptoms that you state, you will either be directed to begin a telehealth visit or you will be directed to come directly to the health center. Now, since we are a healthcare facility, the CDC recommends, and we are following CDC recommendations, that masks and social distancing are still required regardless of your vaccine status. We ask that you do not bring others to your appointment in order to minimize the number of people in the waiting room. Next slide. Okay, for our new patients, which all of you are, we have packets on our website that you need to download and fill out. And you can find that on our website at www.longwood.edu/health. Okay, these forms can be access through our portal at the web address above. And you can actually complete your immunization records through the portal and tuberculosis screening and your demographic information. Your supporting documents for your immunization, your COVID immunization card or insurance cards. Please, if you send us your insurance card, send it front and back, and email those to studenthealth@longwood.edu, or you can fax them to us. You could also drop them off in person if you come here for orientation. Next slide. Okay, the immunizations that are required. This is not something we make up. We do not have any say in this. It is set by Virginia law. All immunizations must be up to date and submitted to the University Health Center, or you will not be able to register for your spring classes. If I do not have your immunization records by October 1st, I will place a hold on the records and you will not be able to register. This happens every year. I get calls mid-October when registration opens up of students wanting to bring me their stuff immediately and be able to register for that last spot in that class. If I have to place a hold on your record, it will take 24 hours for me to take that hold off your record. So please do not put this off. Get these into us as soon as possible. Next slide. All right, these are the immunizations required by the state law. You are required to have measles, mumps, and rubella, or you have to provide titers showing that you are immune. You also have to have a TD or DPT or a booster within the last 10 years if it's more than 10 years old. You have to have had polio. Meningococcal is one that we highly recommend, but it can be waived. The hepatitis B series is the same way. The tuberculosis screening form. This is the one that gets everyone. They will turn in all their immunizations, but they will fail to fill out this one little form, and we're chasing people all the time for them. Now, we have some others listed here that are optional, and we highly recommend them. The varicella for chickenpox, hepatitis A, meningococcal B, and HPV. We really do recommend that you get these, but they are not a requirement. Next slide. This is the topic that everyone is asking about, COVID-19. All right, Longwood is saying COVID-19 vaccine is a required vaccine as of this moment. However, we also realize that many people do not want to do this until it becomes no longer emergency use authorized. We understand that. We're taking a more libertarian view with this, and students will now fall into two categories. If you're vaccinated and you confirm your status with us, you'll pretty much have like a normal year. You're not going to be excluded from anything. You won't have to wear a mask. And you just pretty much have a normal year. If you decline to get the vaccine or decline to confirm your vaccine status with us, regardless of whatever reason you have, you'll have to agree to certain health-related restrictions, such as quarantining if you're exposed, wearing masks indoor, and you may be restricted from some social activities such as club sports. We take all our health guidance from the CDC and the Virginia Department of Health. And as things change, as we all know, this has been a very moving target with lots of changes. We will keep you apprised of the changes, and hopefully they will all be for the better. In late July, you will receive a link telling us how to confirm your vaccine status and whether you've received it or not. We are monitoring all the variants, such as the Delta variant, the spread, and maintaining communication with VDH and state officials. Currently, Longwood will not offer fully online schedules to students who decide not to be vaccinated. Next slide. Now, I mentioned a moment ago, quarantine and isolation. Potomac Healthcare Solutions is running an isolation facility here on campus along with Longwood. We have 43 beds. Okay, if you are unvaccinated for COVID-19 and you're exposed or you contract COVID-19, you will have to quarantine or isolate in this facility. You will not be able to stay in any Longwood managed housing. And if you live off campus, you will be required to quarantine or isolate in your residence off campus. Now, if you live on campus and you come down with COVID-19, you can either stay in the isolation facility or you can go home to your parents. Either way is fine. We just want to make sure that you're safe and that we keep this campus safe. Next slide, please. Insurance. All students will be able to be seen at the University Health Center, regardless of your insurance status. You do not have to have insurance to be seen here. If you do have insurance, though, we will be charging your insurance company. What we will not do is we will not charge you any copays. We will not balance bill you for anything that the insurance company does not pay for, with a few minor exceptions. If you do not have insurance or your insurance applies everything to deductible, there will be some small charges for the in-house labs. Now, labs that cannot be done in-house are sent out to a contracted lab. Those people will bill you separately or bill your insurance company separately. We have no control over that. If you need these labs done, I highly advise that you come to the health center with some type of insurance. Next slide. This is some common charges for those that do not have insurance or if it gets applied to the deductible. Now, as you see, these are not huge payments. Strep test is $23.50, influenza test $35, and so forth. These are the five most common ones. We are not trying to get rich off of our students by any means. This is pretty much just covering our cost of those tests. Next slide. Okay, if you do incur a charge, my billing manager will send you a bill to your live.longwood.edu email account. All right, we give discounts for prompt payment within a week. I've given her a lot of latitude to do that. If she's not having to chase you down and you're making her job easier, she will put discounts on it. If you're unable to pay the full amount, that's fine. We understand that, and we will arrange payments. Like I said a moment ago, our contracted labs, LabCorp and Central Lab, bill separately from us. Next slide. Okay, before we go into the questions, which I should have said this at the beginning, if you have questions, please put them in the chat and we will look at that. I do want to talk a little bit about health information. All right, the health information, your health information is very important and we keep it secure. We will not send any health information to your live.longwood.edu account. You will get an email saying you have a secure message in the patient portal. You will have to go to our website, sign into the patient portal, and read those messages. If you're missing any information on your immunization status and your compliance, that is where you will see those emails. We send emails out to everyone as we receive them, as we receive your immunizations. If you're missing anything, we will send you an email. So please check those emails. Same time, we do not do any blanket releases at the health center. If you want to share your information with your family or whoever, you will need to sign a release at the time you are seen for us to release that information. Most times it involves you, the provider, and whoever you want us to talk to, all on the phone together at the same time. But we do not do blanket releases where mom and dad can call us at any time. So with that being said, if you have any questions, hopefully they're in the chat or the Q&A. I will turn that over to Emily because I can't see them.
Sorry, yeah, we got technological things this evening. We have one question, which is a good one, and I went ahead and typed a response to Heather, but I want to read the question too. If I break a bone or something of that sort, something serious, is there a medical provider or is there a hospital that I would go to nearby?
Yes, Centra Southside Community Hospital is about a block from the campus. It's not very far at all. If you come to the health center and we will stabilize you here, and then we will send you to Centra probably by ambulance. Unless you have somebody that can take you and you're able to go by a vehicle, we will make that decision there. Sometimes we'd much rather you go by ambulance because it would be safer for you, for your health.
Ron, no one has asked this question, but we always get it at orientation. What do people do if they have prescriptions that they're going to need to pick up?
Need to pick up.
Like CVS, how do they get their prescriptions?
CVS is not far, and neither is Walgreens. They're not very far. Now, Farmville does have a family pharmacy, Farmville Family Pharmacy, that delivers. So when you come in and we write a prescription for you, we will ask you what pharmacy you want it to go to. If it's family pharmacy, they will bring it to you. They're happy to do that. CVS and Walgreens are fairly close, pretty much within walking distance.
Thanks. That's all we've got in the chat so far.
Really?
Yeah. This group read up on everything ahead of time. Any other questions? Okay, I can say from experience, our health center is really, really good. I know a lot of my colleagues will go to the health center rather than their own doctor. So that's great. It is a good thing. Please do get your immunization paperwork in. We just got the question, can we bring the health forms to orientation? Yes, you can bring the health forms to orientation. You can also submit them online. You can mail them or you can fax them. You can really do any of that. But if you're coming to orientation anyway, that's an easy thing to do. We do have one question about those forms. As part of them, do I need an actual physical performed by my primary care physician prior to the start of school?
No, you do not need an actual physical. We need your immunizations and we need you to fill out the tuberculosis screening form.
Okay, here's another question. Is there a way to request a female doctor or any doctor in particular?
Yes, Dr. Wade's our only male doctor. All the rest are female. So you can request a certain physician or provider.
Okay, question, has there been any change regarding the mandatory COVID vaccine? No, no change from what was just announced here. It is mandatory. You'll get a form by email later in July, and you can either submit your confirmation that you've been vaccinated or you can decline it, and that will come with a few restrictions. The immunization paperwork must be signed by a doctor, though. That's a yes, right, Ron?
Somebody in that office. We will accept a nurse's signature as well.
We got a question. What activities besides club sports would you possibly be excluded from if you opt against getting the vaccine?
Possibly some social mixers at some of our fraternities and sororities. We have all sorts of social gatherings that you may be excluded from. More information on this will come out here later this month.
We have a person saying, do I need to have my COVID vaccination card copied as well as my insurance card when I turn in the forms? obviously that's a good thing if you have that, but you can also fill out the form online when you get it by email.
Yeah. I mean, if you submit a copy to us, we will have it on file then. So if you lose it, don't have it, we will be able to provide one to you if you submitted that to us.
Another question, does the health center give allergy shots?
Yes, we do. We do. We ask that you bring your serums to us. We will store them for you here. And if you stay compliant and get your shots when you are supposed to, that's fine. If you go too long without getting your shot and get out of compliance, we'll refer you back to your allergist.
Here's a great question. Will Longwood be offering the COVID vaccine or the health center, or would they need to go to Centra or some other place to get it if they want to get it after July?
Right now, CVS has got them. All the pharmacies have them. The health or VDH is doing a clinic every week. At the moment, I really don't see a reason for the health center to do it because it's very plentiful in this area right now.
Another question, I see the hepatitis B and the meningococcals are not mandatory. Is there any further information available regarding these vaccinations to help make a good decision?
On our website, there is information on all those vaccines. So go to our website and read up on it. It explains to you what can happen. Many students decide not to just because they don't like needles, and others, if you want to get it, we will have it here, I believe in mid-September when VDH comes.
Lots of thank yous. For those of you who are coming for the July orientations and are concerned about where the health center is, I know that people often are. It's right across the street from campus. If you can find Chick-fil-A, you can find the health center. We would be happy to walk you there if when you're here, you want to drop off your forms. Okay, question, can the forms be faxed by the doctor?
Yes.
That was easy.
Yep.
Any other questions? All right. Ron, what's your website one more time?
www.longwood.edu/health.
Put that up in the chat for everyone. So make a note of that. It's a good site. The immunization forms, everything else are up there. Okay, question, where did you say we could take the forms when we have them filled out? Well, if you want to bring them to orientation, we'll help you get them to the health center. You can also submit them online via fax or send them by email. If you have insurance, do you pay $20 for the flu shot?
No, you do not. If you have insurance, we will only charge the insurance. The $20, which is much cheaper than any other place will do it, is only for those who don't have insurance.
Get your flu shot. A lot of people in a small space. right. Well, if y'all have questions about this, you've got the website there and that links to their email. If you have more general questions, first year at longwood.edu is a good place to go with those. We do check that daily and we will get back with you.
And please feel free to give us a call here at the health center if you have any more questions.
All right. We good to go? Gonna go ahead and stop the recording then. Thanks, everyone.